All right. So we'll do it region by region the way they do it in med school. Okay. So, well, they don't do system by system then. Like, what's everything in this part of the body? So, larynx. Okay. Trachea. See the rings? Cartilaginous rings that we saw in the sheep trachea?
Yes.
Thyroid gland sitting on top of the trachea. And this thing right here. Thymus gland sits around the thyroid like so. Okay, so thymus, thyroid, thymus. Carotid artery, taking blood up to the head. Jugular vein, draining it down from the head.
Jugular vein's blue?
Jugular vein is blue. Yeah, veins are always going to be blue. Arteries are always going to be pink.
Cool.
Subclavian artery. Subclavian, under the clavicle, yeah? Down here. Here on the heart. Pulmonary trunk. Coronary arteries. What's this big blue one going into the right atrium? What vein goes into the superior vena cava? Superior vena cava. Next to it, it's usually white like this, the aorta. Okay, so superior vena cava, aorta. The aorta is going to form the carotid arteries. The jugular veins drain into the superior vena cava. Okay, from below, what's this big blue one coming up from below into the right atrium? Inferior vena cava. Okay, it starts all the way down here, and we'll look for it again in a minute, but that's a good place to find it. Okay, lungs, liver. Where is it? Gallbladder. A lot of the pigs, it's a real bright green, not so much on this one. Stomach. Spleen. Very nice. Pancreas. See the yellow, bumpy looking thing there? That's the pancreas. Underneath the stomach. Small intestine. All of this is small intestine. Inside the small intestine, the mesentery. That's a special part of the peritoneum that goes to the small intestine. The large intestine has 3 regions. The cecum, which I'm looking for. The start. The coiled colon. And the descending colon, going down. Okay. Kidney. Okay. Ureter, going to the urinary bladder. All right, so what's this pink one going into the kidney?
Can't see it.
Renal artery to the kidney. Renal vein away from the kidney. And you see the blue thing here, that's the inferior vena cava. It starts down here and goes all the way up.
Wait, that's the vena cava.
That's the inferior vena cava. The renal vein goes into the inferior vena cava and then up.
From the kidney?
This is a female, from the kidney.
Cool.
Okay, this one next to it is the dorsal aorta. Okay? So from the heart down, bringing blood to the body, and you can see the renal artery going into the kidney from it. So I use it down here a lot because you can go blue, inferior vena cava, white or pink, dorsal aorta, green, descending colon. So ureter, bladder. The pink ones on either side of the bladder are the umbilical arteries. Everybody always wants to call them the urinary arteries because they're next to the bladder. You got to fight against that. Okay. So that's the umbilical artery. The umbilical vein is this one that was coming out of the liver. Because initially when you started your dissection, it was like this, right? Okay, so that's it. That's the other end of it. Okay. This is a female pig. So what I'm looking for here is the, okay, out at the end, little bean-like thing is the ovary. All of this curly stuff are the uterine horns. I was talking about this in lecture. So ovary, uterine horn, ovary, uterine horn. See where they meet in the middle here is the uterus. You can see it real well on this. To see the vagina, you'd have to break the pubic bone, which I don't really feel like doing. So, you know where it is, you know what it does, but you don't necessarily have to find it. So uterine horn, vagina, uterus. Excuse me. Iliac, arteries and veins.
Surprise.
Because I always forget them, but that looks like one of them right there. Going down to the hind legs.
What is that?
Iliac. The iliac artery, yeah, starts right about there.
What does that do?
Okay, the pink thing right there?
Yeah, the arteries taking blood to the hind leg, the veins draining blood away from the hind leg.
Okay.